Welcome to Science Access. In today's class, we'll be talking about the parasitic ciliate and we're talking about the Balantidium coli. If you know you have not subscribed to this channel, please subscribe to support us. Alright. Note that the Balantidium coli belongs to the phylum Ciliophora, cilia, or ciliate, Ciliophora, alright? It belongs to the phylum Ciliophora, and the general characteristics of the parasitic ciliate include the fact that it possesses what? Cilia, alright, ciliate. It possesses cilia, as you can see from the diagram being displayed on, but they also possess micro and macro nucleus. Micro, small nucleus, and macro, big nucleus. In terms of reproduction, they reproduce through conjugation sexually or through binary fission asexually. All right, please take note of that. All right, let's talk about the general morphology of this organism, Balantidium coli. Before we talk about that, the classification of Balantidium coli is actually being displayed on the board. All right. Now, let's talk about the morphology. They actually exist in two forms. Remember, they are protozoa parasites. They exist in two forms: the trophozoite form and the cyst form. The trophozoite form is one that causes a lot of damage in the gastrointestinal system or in the intestine of humans. But we'll talk about that in details when we are talking about the pathogenicity. All right. Now, let's discuss the morphology. As you can see from the diagram being displayed on the board, the trophozoite form possesses cilia, possesses micro and what? Macronucleus. Their size actually ranges or can range from what? 30 micrometer long to even as high as 150 meter long. While their width, in terms of width, they can even be as big as 100 micro meter. Note the shape that you can see on the board. They are actually oval in shape, or spherical as some may call it. And note also the fact that it possesses micro, as I said before, small nucleus and macro nucleus. The cyst form, as you can see on the board, have the protective covering, the cyst, the protective covering. They also possess the micro and what? The micronucleus. The trophozoite form, as you can see from the diagram, is the large active feeding form present in the intestine of mammals, causes balantidiasis. As you can see from the diagram, the trophozoite form actually possess cilia covering the body and possess micro and micronutrients. Micro, small; macro, large. Right? You can see that the anterior side possesses the cytostome, while the posterior side possesses the cytoplasm. Please take note of that. You can also note that the cyst form also possesses the micro and macro nucleus, as well as a covering, a protective covering, thick protective covering. Let's talk about the life cycle of Balantidium coli. The life cycle of Balantidium coli begins by humans or mammals taking in food or water contaminated with the cyst of Balantidium coli. Once it's taken in, it passes through the stomach into the intestine, where it undergoes a process called cystulation. That means removing of the cyst or the covering, the protective covering. Removing. If you say encystation, it simply means the organism forming a cyst, while S means what? The organism is removing the protective covering to form what? The trophozoite. So in the intestine, the organism undergoes a process called encystation, all right, and produces what? The trophozoite stage, which is very active, feeding and on various things in the intestine, such as the bacteria. If condition is favorable, it can even attack the lumen, feed on the covering of the intestine, resulting in what? Ulceration of the intestinal tract, which can lead to what? The diarrhea, in some cases dysentery, and various form of symptoms that can result from these organisms. Note that after activity of the trophozoite in the intestine, as it passes down the process, moving through the colon and the cecum and all that, as it moves down the intestinal tract, it undergoes another process called encystation, forming cyst. Because the reason why this cyst is formed is because if this organism, if the trophozoite is passed into the environment, it cannot withstand the environmental condition. But if the cyst, if it undergo what we call encystation, forms cyst, and is now passed out with the feces, this cyst can what? Withstand the environmental condition till a new host what? Take back the cyst into the system, resulting in what? In the life cycle starting all over again. It's a very simple process, as you can see from the diagram. All right, note that the trophozoite stage usually reproduces through the process of binary fission in the intestine. Let's talk about the pathogenicity of Balantidium coli. Remember when I talked about the trophozoite stage being released into the intestine? Encystation, which is removal of the wall of the cyst of this parasite and releasing the trophozoite can occur in the intestine, and the trophozoite is released. Now, when this trophozoite is released, it can feed on various material in the intestine. For example, if it's feed on bacteria, for example, and you realize that there is no symptom that results from this. So in some cases, Balantidium coli infection is actually asymptomatic. No symptom will be observed. But in other cases, when the condition is favorable, it can actually attack the epithelial wall of the intestine. If this is attacked, the tissue damage can result, can damage the tissue, the wall of the epithelium, and result to what? Ulceration. Now, ulceration can result to hemorrhage and can even result to other secondary what infection. Bacteria can infect this wall, resulting to other complications. So these are some of the facts that you need to know about um, pathogenicity of the Balantidium coli. Symptoms that you can observe include diarrhea, dysentery, abdominal pain, and in some cases perforation of what? The intestine. Please note some of these facts. Others are being highlighted on the board. Now, let's talk about the epidemiology. When you talk about the epidemiology, it's being associated with, or is you are discussing the distribution, geographical distribution of this disease, talking about how it's being transmitted, or even the risk factor. Now, take note, Balantidium coli is actually distributed worldwide, but it's most concentrated in the tropical and the subtropical region, especially in the rural region or in developing what nation where hygienic condition is what poor. Now, in rural region, you see them taking, for example, in Nigeria and some other African countries, even in the rural region of some developed world when they have inadequate water supply. River water can serve, or contaminated water can be taken in, and this can what result to what infection of what these what humans or even animals. Note that pig is the primary reservoir of this parasite, and it's actually asymptomatic in what? Pig. The risk factor in many organisms or even in many animals and humans, the parasite may show no symptoms, may be asymptomatic, but it is actually severe in people with what? Deficiency in their immune system, people with HIV or AIDS, some malnutrition, and all that. Now, it is also prevalent, as I said earlier, in region where their hygienic what condition is what poor. Note that. How is it actually transmitted? The transmission what route or dynamics? It is through what? Fecal oral what route? Fecal oral route. Note what do I mean by fecal oral route? Now, contaminated person pass out the trophozoite as well as the cyst through what? The pass it out along with what? The feces. Now, what happens? The trophozoite cannot survive outside the host, so definitely that will die off. But the cyst can survive, can withstand strong environmental condition because, or harsh environmental condition because it's actually what? Dormant. All right. Now, when this organism is when the cyst present in the feces is passed or is washed, maybe through rainfall or some other is form, and it contaminates water that you drink or the animal taking, or in some cases it may even contaminate food. What happened? The person is actually what? Affected. The person that taking the contaminated water or food is actually what? Affected. So in this case, we can say it is fecal, feces, oral, through mouth, root. So contamination is usually through what? Or most common through what? The fecal what? Oral route. Now, how do you diagnose balantidiosis or Balantidium coli infection? the most definitive diagnostic method is actually through stool examination, where you actually examine the stool for the trophozoite stage, which is the active stage, or even the cyst, which is the dormant form. Now, some of the common method of this stool examination include the direct smell method, as well as the formal concentration techniques. So it's a very simple process of doing that. There are other methods of diagnosing these symptoms. You can actually do that through symptoms examination. You know that some of the symptoms include diarrhea, abdominal pain, dehydration, vomiting, and all that. So you can talk to the patient and do a simple symptom examination. Other methods include stool culture, usually to isolate the organism. Serological techniques as well as endoscopy are rarely used in this case, but in some cases or severe cases, this can be carried out. Let's talk about the treatment of Balantidium coli. Note that the common drug used in this case is your common tetracycline can be used. You have the iodoquinone and you have the metronidazole can also be used in this case. Why the control method in this case is simple: personal hygiene, environmental hygiene. The pig handlers, for example, should ensure proper environment and proper hygienic environment and handle pig in such a way that they avoid the fecal oral contamination or fecal oral transmission occurring when they are handling the pig. So it's a very simple concept. This is the end of the lecture. Please subscribe and like and comment to support this channel. Thank you for watching.